Cannabis therapy, also known as medical marijuana therapy or cannabis-assisted therapy, involves the use of cannabis or cannabinoids under the guidance of a healthcare professional to alleviate symptoms of various medical conditions or to improve overall well-being. It encompasses a range of therapeutic approaches that utilize cannabis or its derivatives for medicinal purposes. Cannabis therapy can involve different forms of administration, including smoking, vaporizing, ingesting edibles, or applying topical preparations. The choice of administration method depends on the individual's condition, preferences, and the specific therapeutic goals. The therapeutic effects of cannabis are primarily attributed to its active compounds, known as cannabinoids, such as THC, tetrahydrocannabinol, and CBD, cannabidiol. These cannabinoids interact with the body's endocannabinoid system, which plays a crucial role in regulating various physiological functions, including mood, pain sensation, appetite, and memory. Cannabis therapy is used to manage a wide range of medical conditions, including chronic pain, inflammation, nausea and vomiting, muscle spasms, seizures, anxiety, depression, PTSD, post-traumatic stress disorder, insomnia, and appetite loss associated with conditions like cancer or HIV/AIDS. Patients interested in cannabis therapy typically consult with a qualified healthcare provider who is knowledgeable about medical marijuana. The healthcare provider evaluates the patient's medical history, symptoms, and treatment goals to determine whether cannabis therapy is appropriate and develops a personalized treatment plan tailored to the individual's needs. It's important to note that cannabis therapy should always be conducted under the supervision of a healthcare professional, as improper use or dosage can lead to adverse effects or exacerbate certain medical conditions. Additionally, the legality of cannabis therapy varies by region, so patients should be aware of the regulations and obtain medical cannabis from authorized sources. In the midst of life's chaos and turmoil, there was a woman named Lily. Lily had been grappling with overwhelming stress and anxiety for quite some time. The weight of responsibilities, the incessant demands of work, and the constant pressure of societal expectations had taken a toll on her mental and emotional well-being. Despite her efforts to find solace through various means, she felt like she was losing the battle against her own mind. One day, a close friend noticed Lily's struggle and suggested an unconventional approach: cannabis therapy. Lily was initially hesitant and apprehensive. She had heard about cannabis, of course, but she had never considered it as a form of therapy. However, seeing no improvement in her mental state despite trying different methods, Lily decided to give it a chance. As Lily entered the serene space of the therapy center, she was greeted by soothing music and the calming aroma of essential oils. She met with her therapist, who explained the process and assured her of a safe and supportive environment. Lily felt a glimmer of hope as she embarked on this new journey toward healing. During the therapy session, Lily experienced a profound shift in consciousness. The effects of the cannabis gradually washed over her, melting away the layers of tension and anxiety that had built up over time. It was as though a weight had been lifted off her shoulders, and she could finally breathe freely again. In this state of deep relaxation, Lily found herself delving into the recesses of her mind, confronting varied emotions and unraveling the knots of unresolved trauma. As the session came to an end, Lily emerged with a newfound sense of clarity and peace. The fog of negativity that had clouded her mind for so long had lifted, revealing the radiant light of hope and optimism. She felt empowered, as if she had rediscovered a long-lost part of herself that had been buried beneath layers of stress and anxiety. In the days and weeks that followed, Lily noticed significant improvements in her mental and emotional well-being. The daily stressors that once seemed insurmountable now appeared manageable, and she felt more equipped to handle whatever challenges life threw her way. She also found herself reconnecting with the simple joys of life, taking pleasure in the beauty of nature and the warmth of human connection. Inspired by her transformative experience, Lily decided to share her story with others. She became an advocate for cannabis therapy, spreading awareness about its potential benefits for mental health and wellness. Through her advocacy work, Lily hoped to break down the stigma surrounding cannabis and provide hope to those who were struggling in silence. Ultimately, Lily's journey with cannabis therapy was not just about finding relief from her own suffering, but also about embracing a new perspective on life. It was a journey of self-discovery and empowerment, one that allowed her to reclaim her happiness and live authentically, free from the chains of anxiety and fear.